Hello, Mr. Young. I'm here to do your health assessment history today. My name is Ashley. I'll be your nurse. So how are you feeling today?
Generally pretty well.
Pretty good.
Yeah.
Can you go ahead and state your full name for me?
Steve Young,
And how old are you?
42.
What is your marital status?
Married, have 2 children with a third on the way.
2 children. How old are your children?
7 and 6.
So pretty young.
Yeah.
Keep you pretty busy.
Oh yeah.
And what do you do? What is your occupation?
I'm an accountant and a CPA.
Okay, is that pretty high stress? Do you have a lot of deadlines
yeah.
and whatnot?
Yeah, it's pretty
Okay.
stressful.
Do you do any activity to help with the stress ever?
Not too much.
Okay, any kind of reading, jogging, leisure stuff can kind of help with, maintaining stress and whatnot. How many hours do you think you work per week?
Oh, a lot. Over probably 50.
So it's probably hard to even get some of that in.
Yeah.
And what would you consider your race and ethnicity to be?
African American.
Do you have any allergies to anything that you know of?
No, but I kind of sneeze and stuff when I mow the grass.
Seasonal maybe allergies?
Yeah, maybe.
Do you have any history of illnesses as far as?
No. Childhood, I had the chicken pox.
You had the chickenpox in childhood?
Mm-hmm.
Do you have anything going on right now as far as issues? What is your concern coming in here today?
It is to try to get a healthier lifestyle and and what I need to do to prevent another heart attack. So
okay.
Yeah.
When was your last heart attack?
About a month ago.
About a month ago. And did that result in hospital time?
Yes.
Okay. You said you had chickenpox as a child. Did you have any other illnesses as a child?
No.
No. Did you have all your immunizations as a child?
Yes.
Okay. Do you get your normal screenings as far as cervical and all of that?
Yes.
Do you have any history of medical or surgical history? Have you had anything done?
No.
No. Okay. Are you on any medications right now?
Not prescribed, just over the counter.
And what do you take?
Ibuprofen.
What do you take it for?
Migraines.
Migraines. How often do you get your migraines?
They're occasional. The last couple days.
Okay.
I get one.
Where do you usually feel the pain when you have a migraine? Is it a certain spot? Is it like your sinuses or just a certain spot in your head?
No, probably up here.
Okay.
Behind the eyes.
Okay. Have you seen anybody for your migraines, or do you just go ahead and take the over the counter?
I just take the over the counter.
Okay. Do you have any family history of illnesses as far as
No.
heart disease or hypertension, stroke? No asthma?
No.
Do anybody have the seasonal allergies like you do?
Not that I'm aware of.
Okay. Is your mother and father living and
yes,
well?
they're both alive.
Okay.
In fairly good condition.
Okay. How many siblings do you have?
I don't have any.
Don't have any? Okay.
Mm-hmm.
What would you consider your nutrition to be like?
I'm a stress eater, so if I get stressed out, yeah. But I eat whatever I want. So.
Okay. Do you have any cultural or ethnic preferences as far as like eating?
No.
So you have pretty well variety
Mm-hmm.
whenever you're with your diet. Okay. Do you have you had a recent decreased appetite or increased appetite?
Probably increase.
Just with the stress?
Yeah.
Okay. Any nausea, vomiting recently
No.
because of food or anything? Do you have any difficulty swallowing or chewing?
No.
Okay. Have you had a recent weight gain or weight loss?
Just the weight gain.
Weight gain?
About 10 pounds.
10 pounds, okay. Did you do tube feeding as a child or anything? No? Okay. As far as like sleep patterns, do you have any difficulty sleeping?
No.
No? Okay. You probably don't have time for naps really, do you?
No.
How many hours of sleep do you think you get per night?
6 to 7 probably.
6 to 7. So close to what you're supposed to get, not quite. It's hard to get all that sleep. Do you exercise regularly
No.
or ever?
Very rarely.
Very rarely, okay. Do you do any alternative therapies as far as like aromatherapy, acupuncture, anything like that?
No.
Okay. Do you ever go to the chiropractor or anything?
Occasionally.
Occasionally. How often would you say in a month that you make it to the chiropractor?
Oh, it's probably once every 3 to 6 months.
Okay.
Yeah, it's not very often.
Are you currently having any pain?
No.
No. Okay. What would you say your language of choice is?
English.
English. Okay. Is there any culture that is cultural specific to you that is important to you?
No, I'm Catholic.
Catholic. Okay.
Mm-hmm.
Have you undergone any major life changes recently? Would it just be expecting the new child and all of that, or?
Yeah, well, there's that, and then my son is home from being hit by a car. He was in the hospital.
Oh my gosh.
He had a broken leg and pelvis.
But he's doing okay now, otherwise?
Well, he's at home and requires some assistance, but.
Okay, so that's kind of an added stress for you
Yes.
also. Going back to in the past, do you have any history of abuse?
No.
No. Okay. Have you ever smoked?
Yes. I'm
How-
a smoker now.
How often? How much?
It's usually 1 pack a day.
One pack a
And
day.
I've been a smoker for about 15 years.
Okay.
Tried to quit several times using the gum, but it's just unsuccessful.
Would you like some more information today about quitting?
Yeah, that would be helpful.
Okay. Have you tried anything else as far as tobacco or snuff?
No.
How often or do you drink alcohol?
2 to 3 times a week I have a beer or 2.
Beer or two? Okay. Do you do any recreational drugs?
No.
How about drink caffeine?
Yeah, I have the usual 1 to 2 cups of coffee a day.
Okay. Never use no soda or anything like that, just coffee?
Mostly coffee, yeah.
Okay. Are you currently receiving any physical therapy for anything?
No.
What about occupational therapy?
No.
Seem to be pretty good in that department. What is your current height and weight?
5'9" and about 250.
Move on to your skin, hair, and nails. Do you have any issues with your scalp right now?
Just some dry flakes. I use dandruff shampoo, over-the-counter dandruff
Over the
shampoo.
counter, okay.
Mm-hmm.
Just like a Head and Shoulders brand of some
Yeah.
sort? Okay. Would you say your skin and nails are in good condition? Do you have any issues with skin lesions or
No.
wounds of any kind?
Mm-mm.
Nail beds seem normal?
Mm-hmm.
Okay. Nothing as far as skin, hair, and nails causing you any pain
No.
of any sort? Okay. And you said you get migraines.
Mm-hmm.
Do you wear contacts or glasses?
No.
Okay. When do you think your last eye exam was?
It was probably a month ago.
A month ago? Do you usually go on a normal basis?
Yeah, you try to go every year.
Okay. Have you had any issues with your ears?
Mm-mm. No.
Is there any history in your family of ear problems or anything as far as hearing loss and whatnot?
No.
Nose, mouth, and throat. We will move on to, are you having any issues with your sinuses or?
Just the occasional seasonal allergy, I guess, when I
Okay.
mow the grass.
Would you say your smoking has caused any or mouth or throat issues?
No, not that I can think of.
Okay. And when was your last dental visit?
In March, I believe.
In March, and
This
you
year.
usually do that on a regular basis as
Mhm.
well?
Yeah.
Okay. Do you have any history of issues with your thorax or lungs?
No. Maybe a little short of breath when I, try to take off. It's like running or something, but
Okay.
I don't exercise, so
Any, like when you do stairs or anything like that?
yeah, a little
Just
short
normal
of breath. Yeah.
walking upstairs, that might give you a short breath too?
Yeah.
Okay. Do you have any heart issues or family history of any heart issues?
I didn't until this last episode.
Until this heart attack?
Yeah.
Okay.
It's all kind of a surprise.
Yeah. It can happen that way. How long were you in the hospital for that heart attack? Do you know?
4 days?
4 days. So not an excessive amount?
No.
Do you have any issues with your breast or underarm area?
Mm-mm.
Any pain or anything? Not felt any lumps anywhere?
Mm-mm. No.
Do you have any pain in your abdomen or stomach area?
No.
Okay. Do you have normal bowel movements, you would say?
Yes.
Okay. And when was your last bowel movement?
Yesterday.
Seem normal?
Mm-hmm.
Do you have any frequency or urgency as far as urinating or anything like that?
No.
Okay. Do you think you have any pain or stiffness as far as like musculoskeletal, as far as your extremities and whatnot
No.
moving? Have you ever had any scoliosis or anything like that?
No.
Okay. No spasms or tremors? Okay.
No.
Do you have a history of fractures
No.
in your
Pretty
extremities
healthy.
or whatnot? All right.
Other than the.
Other than your heart attack.
Yeah.
That's good. Would you say you've had any memory loss, or do you have any family members that have kind of a history of memory loss because of anything?
No.
Do you have a family history of dementia or Alzheimer's?
No.
Okay. Never had a head injury or anything like that?
No.
As far as testicular issues, do you have any pain, any irregularities? I can't say that word.
No.
Okay. Any history of STIs or anything?
No.
Okay. When was your last testicular exam?
Last year probably.
Usually go on a normal basis.
Mm-hmm.
Okay. Would you say you've had any history of hot flashes or cold flashes, anything like that?
No.
Feel pretty normal?
Mm-hmm.
Okay. Did you have jaundice as a child?
No.
Okay. As far as your mental health, do you have any anxiety or depression?
Maybe a little anxiety because of everything that's happened lately.
It's all stress.
Yeah.
Would you consider it like to affect mood swings or anything like that?
Maybe on occasion.
Okay. Have you ever had any suicidal thoughts or
No.
anything like that? No. Okay, good. What would you consider to be your perception of your health overall,
I consider it pretty good, except for this spell.
except for your
Yeah,
concern
came-
today?
Came on sudden. I had no, I was not aware that I had a problem. So,
Right. Okay.
but in general, I think it's pretty good.
Overall, pretty good. All right. Well, I will pass on all of this information to the doctor, and we will get back to you as far as continuing on with your full assessment.
Okay, thank you.